Rucha from Team 3K. Today we are at the Sancheti Hospital, which has been the beacon of orthopedic excellence for 56 years. Today we have with us a chairman and the managing director of the hospital, who is renowned knee specialist and surgeon, Dr. Parag Sancheti, sir. So welcome to the show.
Thank you, Rucha. Thank you very much.
What is arthritis and how and why knee is impacted towards it?
Yes. So, whenever we use the word arthritis, people think it's a very big thing or something which is really too much and end of life. It's not that. Arthritis means nothing but degeneration of the bone, or bone has a cartilage in the joint area. So that cartilage becomes worn out. So arthritis means joint, itis means inflammation. So inflammation or degeneration of the joint is called as arthritis. And this happens at any age. Sometimes it can happen early, sometimes it can late. If it happens late after the age of 50, most of the times what we see is the knee joint is getting impacted. The knee which gets affected is that condition is called as osteoarthritis. And then we see many patients above the age of 50, 55, 60 complaining of knee pain. And osteoarthritis is the condition that time. And you ask me why knee gets more impacted, why is it more involved? Because it is a single weight bearing joint. So whole body load comes onto the knee, and once we walk, run or do whatever, the impact is on the knee.
At what age people should start paying attention to the structure of their knee?
I think you have to take care of your joints all the time. But if we are talking about so whenever it is, you can't neglect and say I am so young, nothing will happen to me. Don't misuse or overuse or abuse the joint. That is number one. But if you generally say what age, to answer your question specifically, Rucha, what I feel is after the age of 50, 55, the degeneration starts setting in. I just spoke to you about it, and that's osteoarthritis. So after the age of 50, one should always do some x-rays, blood test, and see if some arthritis is setting in.
How to identify the need of knee replacement surgery?
In other words, there has to be a clinico-radiological correlation. Means your clinical evaluation, examining the knee joint, should match with the X-ray findings. Then you should do a knee replacement. If the patient has severe pain and patient has severe arthritis on the knee, then that is the way we know that knee replacement is required. In other words, if the patient is unable to carry out the day-to-day activities, unable to walk even 500 meters, unable to go for his shopping or to go to marketing to buy vegetables and things like that.
What is the difference between prehabilitation and rehabilitation?
In the recent past, in the recent few years, there's a new concept developed as prehabilitation. First, let me explain you what rehabilitation means. Rehabilitation means the exercise which are done after the knee replacement. Means the knee replacement is done and then we have to rehabilitate the patient by doing knee physiotherapy exercises, knee bending, all those modalities, ice therapy and all that. But in prehabilitation means before the habilitation. So before operation. So prehabilitation is something where we do the exercises before the operation starts. So the patient knows that after operation I have to do these exercises. So they are taught prehabilitation exercises so that they are better prepared to do the physiotherapy after surgery.
Have there been any advances in knee replacement surgeries in recent years?
There have been many recent advances in the field of joint replacement therapy. The first advance is the pain control. First patients few years ago used to get scared of doing a knee replacement because they were scared of the post-operative pain. So now we have something called as a multimodal pain management, where we give injections around the knee, we give adductor pain blocks. After the surgery also certain patches are given and the patient actually has a pain-free recovery. The second advance is in the type of material, the joint we use. We have newer metals now. Initially the joint used to last for 15 years or maybe 20 years. But now with the newer metals, which is oxenium metal or the high density polyethylene which is there, the plastic that has a new material, the way it is made. So the joint lasts longer. Number 3 is the surgery we do. Nowadays we do a surgery called as RTTS, Reduced Tissue Trauma Surgery. Means whatever is the operation, we keep the trauma to the soft tissues to the minimum. We cut very less and that is called as a minimally invasive approach, and that helps for faster recovery of the patient. And the last is nowadays we have the computer assisted and the robotic surgery. So what this has helped is to improve the accuracy. The accuracy of the joint is improved, and with the way it is placed is improved. Nowadays, people are coming with half knee replacement. Instead of replacing the whole knee, sometimes only they replace the half knee because half knee is damaged. And that is called as a unicondylar knee replacement. So that is the newer development. So that way there are many advances, and at Sancheti Hospital we are following all these advances and giving the best treatment to the patient so that they have a very good outcome, they get discharged early, they get back to their work early. So that is the whole advantage of this advanced technology. And initially we used to keep the patients admitted 8 days, but now within 2 to 3 days the patient goes home. Next day of the surgery the patient walks. Within 15 days the stitches are removed and the crutches or the walker is removed, and in 3 weeks we have seen patients getting back to their work and leading a normal life. And this is all possible because of the recent advances in the knee replacement surgery, which at Sancheti Hospital we are adopting.
Thank you so much, sir, for your valuable time.
Thank
you so much.
Bye bye.
And for more such content, please download 3KM app.